As an OB, ideally, I'd love to see all of my patients before they get pregnant to sort of go over their history, make sure there's not any medical details we need to check up on or things that we could tweak to optimize pregnancy. And so when we get that chance, we like to sit down and do a full inventory of the patient's medical history, surgical history, family history. So I encourage anyone who's going to go for a preconception visit to sort of gather that information. Ask family members, does anybody have any problems with pregnancy? Make sure you know a little bit about your family history so we can help identify any risk factors there. We also will want to go over a travel history about where you've traveled in the last year, 6 months. Zika is a very current problem that we're facing, and there's very clear travel guidelines for both the women and the men. So I think a lot of soon-to-be expecting moms know that they shouldn't go anywhere where there's Zika, but the truth is also that actually it's more important, shouldn't say more important, but that it's also important that dad not travel anywhere, and actually the travel restrictions exist longer for dad, so it's 6 months for dad to not travel anywhere with Zika prior to trying to get pregnant. And then of course we do any other travel history to more exotic areas with unusual illnesses there. We want to do a dietary inventory, make sure you're getting an adequate balance of nutrients in your food. Ideally in your food, we really try to encourage women to get nutrients directly from eating healthy foods as opposed to supplementing this and supplementing that and protein powders here and there. And then we want to make sure you're on an appropriate amount of folic acid. We know women that take an adequate amount of folic acid prior to getting pregnant have a lower rate of babies with spina bifida or some brain defects, so we want to check in on that. One of the things that we like to look at is body weight, or a BMI, body mass index. We know that women that are closer to an ideal body mass index have a lot lower complication rate in pregnancy than women that are above that. So it can be an opportune time to talk about changing diet and lifestyle and trying to bring down that body weight before pregnancy. Not only because that will help reduce the risks of pregnancy, but also weight loss helps increase your chances of getting pregnant as well. And then we like to check in on dad too, and if he can come to the visits, that's great. If not, it's a good idea to get sort of a medical history from him. Make sure you know about all the things that happened to him as a little boy or as a teenager so that we can make sure we don't need to do any testing on him as well. And then I like to kind of conclude by making sure that this is really the right time for you and making sure that this is your decision and you feel ready and that your network of friends and support are there as best as you think they're going to be, and then get an understanding also of what you're hoping to sort of get from your provider during your pregnancy and your birth.